Hi guys, this is Dr. Bailey from TrayMinder. Today I'm going to do a little video for you guys on teeth whitening. A lot of my patients, after aligning their teeth, they want to get the shiniest, whitest smile possible, and so they're interested in knowing a little bit more about teeth whitening. So before we get started, just want to give you a little background. Our teeth, the enamel actually is like your skin. It has tiny pores. And so when you drink coffee or tea or eat strawberries, blueberries, any of those yummy, delicious foods and drinks are highly pigmented, the pigments will actually enter into the tubules of our enamel. And once that happens, no matter how hard you brush, you can use, those whitening toothpaste, and your dentist does the Profi paste polish. It doesn't actually go into the pores of your enamel. So when we think about whitening, you have to combine a two-prong approach of what's called exfoliating, which is the manual mechanical removal of stains, and combine that with a chemical whitening. So the two most common whitening agents are hydrogen peroxide and carbamide peroxide. You can find those in terms of the white strips. The Crest white strips is a good one that you can use. And you can also use custom trays, which are like these that I got from my dentist. And they'll give you these whitening gels that you can use. This one here is opalescence, and it is a 35% carbamide peroxide solution. So these are going to be a little bit higher concentration, to tell you the truth, compared to your Crest white strips that you can get from the drugstore. And you can go all the way up to the in-office whitening, which is very high concentration of the hydrogen peroxide or carbamide peroxide solutions. Combine that with a light that speeds the whitening process up. So I just want to say that whitening is whitening. So if you use a lower concentration solution, you just have to use it for a longer period of time and use it consistently. If you don't have patience for that, then the in-office option is going to work best for you. So my analogy to explain that is, like, if you wanted to go from LA to San Francisco, you can take the bus, you can drive, or you can take the plane, right? So it's probably the cheapest to take the bus, but you're trading time for money. You're spending more time, but you're spending less money. If you want to get there faster, you're going to have to pay more for your airplane tickets. So that's how it works, but you'll eventually get there. So if you don't want to spend the money to do the in-house or the in-office whitening, then you can try the Crest strips first. That's a very good solution to start out with. I personally like to use the custom tray and higher concentration whitening gel best myself. The reason is because I've done the in-office whitening before, and while I got really good results, my teeth were just a little bit too sensitive, and it was a pretty unpleasant experience for me the first time I've done it. I got a lot of zingers, and for those of you who don't know what zingers are, it's like a very sharp pain, shooting pain that goes through your teeth, like little, lightning thunderbolts. But some people have done it before and they're fine. So probably the best thing to do is to try a low concentration and see how you do. If you get a lot of sensitivity with a low concentration bleaching agent, then the in-office procedure with the light may not be the best option for you. But I like the convenience of doing it at home, and I like the higher concentration so that I can kind of get to where I need to go a little bit faster. But regardless of what you do, once you get to your desired whiteness, so to speak, you have to maintain it. So you still have to do it, you know, maybe once a month or every couple of weeks or every 3 months. It really depends on your diet, right? And also just your teeth. My husband likes to do it, you know, right before his dental appointment every time. He'll wear it overnight, and that's what he does. I get too sensitive wearing it overnight, so I don't do that. I'll do some whitening on a more regular basis. So another thing that I want to talk about is not overdoing it. A lot of you will be tempted to wear your bleaching strips for longer than what is on the label. And while it seems like it's a good idea, it's probably not. And I've been guilty of that myself. It's like running, right? If you are a couch potato and you decide to run 3 miles, while you may feel good doing it at the time, you'll really pay for it the next day. So the other night, I was only supposed to wear this for about 30-45 minutes, and I ended up having it in for almost 2 hours. And it wasn't really my fault. I was putting my son to sleep, and it just took a really long time. And I was feeling fine. I had no zingers, but the next day I was pretty sore. And guess what? Because I was sore the next day, I wasn't motivated to do more bleaching that night. So the idea is that you want to do it so that you minimize your discomfort, so that you're more likely to whiten on a consistent, regular basis. So you want to do it every night for a short period of time, and do it up to 2 weeks or 3 weeks. That's usually when most patients will notice a difference. Some people have a lot of staining, and it may have to take 2 to 3 months to see the result that you need. And I usually will tell my patients to start their whitening after they have a cleaning at the dental office, because they'll do the Profi pumice to clean off any of the surface stains. And then when you combine it with the chemical whitening, it's going to give you better results. All right. So let me, one more thing is that some people have intrinsic staining, and that's called tetracycline staining. Research has shown that if you have tetracycline staining, that's an antibiotic that's yellow in color. And if you take that, if your mother takes that in utero, or you take a dose of tetracycline while your teeth are developing, your teeth will be yellow or have blue staining or brown staining. And those are really difficult to treat, but you can have decent success with a long-term whitening, maybe 3 or 4 months consistently. Or you may need to go actually to see the dentist and do an in-office whitening maybe several times to get the type of results that you're looking for. They also have internal bleaching. And so anyway, talk to your dentist about that. And also keep in mind that as we age, the enamel gets thinner. And when the enamel gets thinner, it becomes more translucent, and the inner layer called the dentin is actually the layer that's just underneath the enamel in your teeth, and it's actually yellow in color. So if your enamel, the outer layer, gets thinner, then the yellow dentin is going to show through more. And so that's why as we get wiser, our teeth can become more yellow or gray. Some people are lucky, they just have thicker teeth and bigger teeth. They have a thicker layer of enamel, and so their teeth appear whiter than some other people. The whiteness of your teeth can also be influenced by your skin color. So your lips or your adjacent skin color, the higher the contrast, usually your teeth will appear whiter. Some ethnicities naturally have a thicker enamel, bigger teeth, and their teeth tend to be a little bit whiter. So there's a lot of biological differences. There's also lifestyle differences too, as I have mentioned earlier, in terms of diet. Okay, so now I'm going to show you how I put on the bleaching gel onto my trays. So here's one that I've been using. I like to keep this in the refrigerator because the bleaching agent, it's an oxidizing agent and it is affected by light. So if you want to increase the shelf life of your bleaching agent, definitely keep it cool and dark. Okay, so a lot of people make the mistake of using too much. All right, and that is not great because not only are you wasting this expensive product, but you're also increasing your chances of irritation and getting that bleaching agent onto your gums, which can burn and increase sensitivity. So make sure that you're not using too much. So here's my lower tray. All right, and I start from the molar. All I use is a tiny little dab. Just make sure that you're putting it on the outside surface, right? So this is the outside surface right here. So I'm going to go in here. I'm going to put it on the middle of the tooth, just a tiny dab, and then like this, and I sweep up. All right, so again, I don't know if you can see that, but it's just a little tiny dab. I'm going to put a little dab here and sweep up. Put a little dab and sweep up. Put a little dab and sweep up. So from the other side, you can see where that is. Okay, so I'm not going to do all of it, but once you put it on, go ahead and use your finger and press the tray against your teeth and give it a little bit of a rub so that it covers the surfaces of your teeth. And for 35% carbamide peroxide, probably you want to do about 30 minutes. If you're starting early and you're very sensitive, I would go low. I would use a 15% carbamide peroxide. If you're using a lower strength whitening agent, you can go a little bit longer time. But for 35%, I definitely wouldn't do overnight with that. That would just be way too much. All right. So that's what I have for you guys. I hope that you found this video to be helpful. If you like it, give it a thumbs up. Make sure you subscribe to the TrayMinder video. And I love to hear your comments below. I'll see you next time. Bye.